Hi, so I've been on vacation the last 2 weeks, so there were no videos up. I'm back now, and I got a question, which is a great question about the Moxy Monitor HIIT training guide, so for high intensity interval training, and about some of the rationale behind that, which I think is a good question. Why we created or why we decided that those protocols should be set as they are. I'm going to try to explain some of those basics so you understand where the rationale is coming from. And now what's important about that HIIT guide is that it's just an example. It's a very basic example. There's lots of variations you can do of that, just like there are lots of variations of HIIT training that you can do. To try to create different stimulus depending on the athlete you have. Certain hits can be more effective or not, depending where you are in your state of training and so forth. But the understanding the basic, at least the rationale behind why we think using NIRS and using the Moxy monitor like this is going to be the most helpful. It'll help understand why we created the HIIT guide like that. So there's always kind of two underpinnings to the rationale that we used. The first one is kind of more of a scientific physiological one. So what kind of physiological mechanisms exist, and how NIRS and Moxy relates to that. And the second one is more of an empirical observational one. What have we seen and what seems to work? And those two things have to kind of match up together, triangulate, and then we decided, there seems to be some consistency here. So we think this is the best approach for now. So the first with the kind of the physiological literature side is if you look at physiological literature, so in physiology, for example, you have creatine phosphate curves, and the rapid use of creatine phosphate and then the replenishment or resynthesis of creatine phosphate. And first of all, those match up pretty good with changes in NIRS signal. So that's already a pretty good thing. Those two things seem to work. So that kind of energetics of creatine phosphate and your NIRS signal, there's some relationship, something's going on there. That makes sense because a lot of the creatine phosphate resynthesis physiologically looks like it has to do with oxidative processes, which then makes sense why it matches up the NIRS signal and makes sense why NIRS would be helpful in looking at how energy is being used, but also in how energy is being replenished afterwards in the resynthesis process. So from a physiological point of view, that seems to make sense that you can use NIRS to assess this kind of bioenergetics. So that's part of it. Then if you want to talk maybe a little bit more practical scientific literature, we can look at things like, well, sprint intervals seem to be pretty effective in training and pretty effective also in things like mitochondrial building, okay? And which is pretty interesting because sprint intervals are short bouts, so we're talking 10 to 20 seconds. And you repeat them and they seem to be pretty effective in that, which isn't really a classical approach to what we would consider to be endurance training because of these really short bouts, but they seem to be effective in building mitochondria, which we think of as an endurance type organelle. Now, I don't know if that's true, but I'm just saying what people tend to say. So if we look at these 10 to 20 seconds bouts, that's kind of what we see when we get people do sprint intervals. These close to max intensities, and you look at changes in your NIRS signal within that type of a range, 5 to say 30 seconds, people tend to max out or minimize their NIRS signal. They deplete SMO2 down to their minimal value in that type of time frame, and then performance tends to fall apart. So that makes sense again. So you have this other kind of very practical literature which is giving time frames two intensities that also again seem to match what we're getting with our near signal. So we have this like very physiological side where I use creatine phosphate as an example, and then we have this again literature based but not so physiological, just kind of very training based, which all in both of these kind of match together with what we're seeing with the near signal. And if we go straight to just observations with the near signal, so we kind of put aside these literature-based findings that I've been citing, and you say you throw a NIRS device, you throw your Moxy on your athlete, and you get them to go do some sprint intervals, for example, and you talk to them, you see how they're feeling after 1, 2, 3, 5 seconds, 10 seconds. It matches up really well. If you stop an athlete in their sprint interval before they bottom out SMO2, the response in almost all circumstances is, I feel pretty good, a guy could have kept going. If you let them bottom out and you continue a little longer, the response is almost in all circumstances, that was really hard and I kind of hit bottom. And if you let them go exactly that sweet spot where they just bottom out, the response is, oh, you stopped me just before it started getting hard. So this is a very observational, it's a very anecdotal kind of evidence. But it's another part of this triangulation as to why we established the HIIT like that. Basically saying that the way that your SMO2 changes and the range of which your SMO2 has changed, it essentially fits into all of these different categories of information that we got back. So it fits into this very physiological type of information. It fits into commonly used training practice kind of literature information. And it fits into empirical field observation from athletes coming back. To kind of maybe clarify that even more. So if you do your sprint intervals the way that we suggest that you do them, so really kind of this, we call them desaturation, resaturation intervals, where you really you just bring your SMO2 value down, but you don't want it to stay down. You just want it to come down as far as it can, and then you want to stop and you want it to come back up. So really these types of sprint intervals, which are 5, 10, 15 second type bouts. If you do them precisely like that, and often there's not that much, the room for error is not that big, because if you go 5 seconds too long on a 20-second sprint interval, that's 25% of increased effort. So, you want to be within a few seconds. You want to make sure that you're cutting the intervals at the right time. If you time them properly, and that's why the Moxy is so valuable, because it really lets you time them properly. It's not just everyone's doing 20-second sprint intervals or 10 seconds. It really lets you individualize. So 8 seconds for one athlete A and 16 seconds for athlete B, depending on the rate of deoxygenation. So if you really time these properly, you're able to repeat performances for a really long time. And if you start going a little bit too long, you see that performance drastically starts decreasing from set to set. And that's a really important observation. And that's really important for volume training as well, because you want to make sure that you can repeat performance. If you can't repeat performance, you're likely not having a high quality training session. I think I'm going to do a couple more on HIIT and on how to use the Moxy monitor with HIIT, because I really think that NIRS might have its greatest potential in helping individualize HIIT training, because there aren't really that many tools that do a great job at that, especially physiological tools. So I hope that made sense. And yeah, I'll put a couple more videos up. Thank you very much. Bye-bye.